Speak what if I told you your blood sugar doesn't end up only rise because of what you eat, but also because of how you drink water. Today, Andapos will show you the science that surprises even many patients. Two men, both 71, same town, same doctor, same waiting room on the same Tuesday morning. One of them walks out with a lab slip that says his fasting blood sugar has crept up again. The other walks out with numbers. His doctor calls steady. They eat almost the same food. They walk about the same amount. The difference between them is Andapos, a pill, and it is Andapos, a superfood. Itandapos, something so ordinary you Andapos have done it a dozen times today without thinking about it once. Itandapos, how and when they drink water. Here Andapos is the number that should stop you. According to the CD-Candapos National Diabetes Statistics Report published in January 2026, about 28.88% of American adults aged 65 and older have diabetes, and roughly 52% of that same age group have prediabetes. Put those two together and you and APOS are looking at something like 4 out of 5 adults over 65 living with blood sugar that is either already high or already heading that way. Not 1 in 10, not 1 in 4, 4 in 5. Now, here Andapos what almost nobody tells you in a 12-minute appointment. Your body Andapos is water balance and your body Andapos sugar balance are not two separate systems, they are wired to each other. Pull on one and the other moves. And after 60, the wiring changes in a way that works against you quietly every single day, starting the moment you open your eyes. Over the next few minutes, Andapos I'm going to walk you through 6 specific water mistakes that are extremely common after 60. Mistakes that may be nudging your blood sugar in the wrong direction. Andapos will show you a hormone almost nobody has heard of that sits at the center of all this. And Andapos will give you 3 checks you can do right now, sitting where you are without a single piece of equipment. Stay with me to the end because the 6th mistake is the one that catches the people who are trying hardest to do the right thing. Let Andapos start by clearing something out of the way. You Andapos been told to drink 8 glasses of water a day. You Andapos probably also been told something even simpler. Drink when you Andapos are thirsty. Your body will tell you. That second piece of advice is not wrong for a 30-year-old. For someone over 65, eat Andapos, the single most misleading sentence in all of hydration. Here in APOS is the correction, and eat and APOS is well documented in the physiology research. Thirst is triggered when the concentration of your blood rises past a certain point. Think of it as a threshold, a line in the sand. Cross the line, your brain sends up a flare and you feel thirsty. With aging, that line moves. The threshold rises. Older adults consistently need a bigger disturbance in blood concentration before the thirst signal fires at all. Studies going back decades, including classic water deprivation work in healthy older men, published in the New England Journal of Medicine, found that older adults simply report less thirst than younger people under the same fluid stress and drink less when given free access to water. So, the signal doesn't Andapos disappear. It just goes quiet. It gets late. Think of a smoke alarm with a weak battery. It still works. It just doesn't Andapos chirp until the room is already full of smoke. That Andapos your thirst mechanism after 60. And if you Andapos are waiting for that chirp before you reach for a glass, you are not staying hydrated. You are managing a small emergency over and over several times a day. And it is Andapos only thirst that changes. Total body water goes down as we age because muscle, which holds a lot of water, gives way to fat, which holds much less. So your reserve tank is smaller to begin with. Your kidneys also get less efficient at clamping down and holding on to water when supplies run short. Smaller tank, weaker signal, leakier system, all 3 at once. Why does this matter beyond feeling a bit dry? Let me give you the stakes honestly without dressing them up. Speak Their Andapos is a large study out of a UK teaching hospital that looked at more than 6,000 emergency medical admissions of patients aged 65 and older. They calculated blood concentration on admission. 27% of those older patients arrived in a state the researchers called hyperosmolar dehydration, meaning their blood was measurably too concentrated and the outcomes tracked with it. Those patients were about 4.5 times more likely to develop acute kidney injury in the first day after admission and had roughly 60% higher 30-day mortality compared with patients who were properly hydrated. That is not a scare tactic. That is a hospital database, and it tells you something important. Dehydration in older adults is not a minor inconvenience that resolves itself. It is a condition that shows up at the front door of hospitals attached to worse outcomes. They're adipose as a second stage specific to blood sugar. There is a diabetes emergency that hits older adults with type 2 diabetes almost exclusively. Adipose is called hyperosmolar hypoglycemic state. Blood sugar climbs enormously high. The body dumps water trying to flush it out, and the person becomes profoundly dehydrated. Clinical reviews describe fluid deficits in the range of 8 to 12 litres. Reported mortality across the literature runs somewhere between 5 and 20% higher at the extremes of age. And here adipose is the part I want you to hold on to. It builds slowly over days to weeks, which means it starts as something small, something that looks like drinking a bit less than usual during a hot week or a stomach bug. If clear, no drama health information is what you came here for, take a second and subscribe and tap the like button. It genuinely helps this channel reach other people who need it. Now, let adipose build the picture properly, because once you see the mechanism, none of the rest of this needs memorizing. It just makes sense. Blood sugar is a concentration, not a total amount, a concentration. Adipose, the amount of glucose measured against the amount of fluid adipose dissolved in. So there are two ways for that number to go up. You can add more sugar or you can take away water. Picture a pot of soup on a low simmer. You have an adipose added a single grain of salt, but an hour later it tastes far saltier. Why? Because water left, the salt stayed. Same salt, less liquid, stronger taste. Your bloodstream works exactly the same way. Lose water across a long dry afternoon and the sugar already circulating in you becomes more concentrated. Nothing new went in, the liquid went out. Now here adipose, where it turns into a wheel that spins. When blood sugar climbs past a certain point, your kidneys stop being able to hold it all back and sugar starts spilling into the urine, and glucose does not travel alone. Glucose is like a sponge. Wherever it goes, it drags water with it. Doctors call this osmotic diuresis. In plain English, high blood sugar makes you urinate more. And every one of those trips takes water out of you that you didn't adipose plan on losing. Do you see the loop? Dehydration concentrates your blood sugar. Concentrated blood sugar makes you lose more water, which concentrates your blood sugar further round and round. The adipose, a wheel that once it starts spinning tends to keep spinning, and in an older body with a quiet thirst alarm, nobody adipose standing there ready to stop it. But the adipose, still not the surprising part. The adipose, just plumbing. The real driver, the thing that reframes this whole topic, is a hormone. When your body senses adipose running short on water, a small gland at the base of your brain releases a hormone called vasopressin. You may also hear it called antidiuretic hormone. Its job description sounds simple: tell the kidneys to conserve water. Adipose, the drought manager. Water adipose tight, so lock the taps. Hold what we adipose have got. Except vasopressin does not adipose stop at the kidneys. Vasopressin also docks onto receptors in your liver. Speak, and when it does, it tells the liver to start releasing stored sugar into the bloodstream and to manufacture fresh glucose. It also acts on the pancreas, where it can prompt the release of glucagon, the hormone whose entire purpose is to raise blood sugar. Read that again slowly. The hormone your body releases when you adipose are short of water is also a hormone that tells your liver to push sugar into your blood. So, the drought manager doesn't adipose, just lock the water taps. On his way past, he throws open the pantry and starts handing out the sugar. The adipose, the hidden villain. Not the water you didn't adipose drink, the hormone your body released because you didn't adipose drink it. Researchers can measure this. They track a companion molecule called copeptin, which is released alongside vasopressin and is much easier to measure. And when they looked at copeptin in large populations, they found something they hadn't adipose expected. People with higher copeptin had a higher risk of developing diabetes, even after accounting for the usual risk factors. That led a French research group to ask a very direct question. Forget the hormone, what about the water itself? They followed 3,615 middle-aged adults who all started with normal fasting blood sugar over 9 years. And they simply asked how much water people drank. During follow-up, 565 of them developed hypoglycemia, blood sugar above the normal range. When they compared groups, people drinking between half a litre and 1 litre of water a day had roughly a third lower odds of developing hypoglycemia compared with those drinking under half a litre. That result held after adjusting for age, sex, family history of diabetes, and how much alcohol and soft drink people consumed. It was published in Diabetes Care in 2011. I want to be straight with you about what that does and doesn't adipose prove. The adipose, an observational study. It shows an association, not a guarantee. And people who drink more water often differ in other ways too. But researchers have since tested the mechanism directly. In one intervention study, drinking a single litre of water dropped copeptin levels by an average of about 39% within 90 minutes. And in a small 6-week pilot of 31 habitually low drinkers who added 1.5 litres of water daily, fasting glucose came down slightly. A small but statistically meaningful drop. Small study preliminary, a much larger randomized trial has been underway to test this properly, and until it reports, we should call this promising, not proven. But promising, free, and almost entirely safe is a rare combination in health. So letandapos, talk about what you actually do with it. Here are the 6 water mistakes that matter most after 60. Mistake number 1, waiting until you feel thirsty. What this looks like in real life is completely unremarkable. You get up, you have coffee, you get on with the morning. Around 2:00 in the afternoon, you notice your mouth is dry, so you have a glass of water. You feel fine. Nothing about your day felt like a mistake. What ended up happening inside is that your blood was slowly concentrating for 6 or 7 hours before your brain bothered to mention it. Remember the smoke alarm with the weak battery? By the time it chirped, the room already had smoke in it. And during those hours, vasopressin was elevated. The drought manager was on duty locking taps and nudging your liver. What to do? Stop treating water as a response and start treating it as a schedule. Thirst is no longer your alarm clock, so use an actual one. Anchor a glass to things you already do without fail. Waking up, brushing your teeth, every meal, every time you make tea, every time you take a medication, that and tapos, fine to take with water. You are not trying to drink more in one heroic sitting. You are trying to never be dry for 6 hours at a stretch. Mistake number 2, the empty morning. This is the one almost everybody makes. Think about the stretch between your last drink at night and your first real drink of the day. 8 hours, maybe 10. Speak. Speak, and you, when Anantapos said, just sitting still through it. You were breathing out water vapor all night. And you probably got up at least once to use the bathroom. You wake up more concentrated than at any other point in your 24 hours. And then a lot of people start the day with coffee and nothing else until mid-am morning. What Andapos is happening inside? You Andapos restarting the day already behind exactly during the window when many people Andapos. Blood sugar naturally runs highest anyway because of the normal hormonal surge that happens in the early morning hours. Itandapos like setting off on a long drive with the fuel light already on and telling yourself you Andapos will stop somewhere along the way. What to do? Put a glass of water on your bedside table tonight. Drink it before your feet hit the floor or right after. Then have your coffee. Yandapos not asking you to give up your coffee and you Donandapos need to. Just Donandapos, let coffee be the first thing that reaches your stomach. Water first, then coffee. That single change fixes the driest stretch of your entire day and it costs you nothing. Mistake number 3, counting sweet drinks as hydration. Here in Apos what this looks like. I drink plenty. I have my juice in the morning, sweet tea in the afternoon, a soda at dinner. And on paper, the Tandapos fluid. Itandapos is wet. It should count. What Andapos happening inside is that you Andapos are solving the water problem and creating the sugar problem in the same swallow. A large systematic review and meta-analysis published in the BMJ in 2015, pooling 17 cohort studies covering over 10 million person years, found that each additional daily serving of sugar stubby sweetened beverage was associated with about an 18% higher incidence of type 2 diabetes and around 13% higher even after accounting for body weight. Interestingly, the same analysis found that artificially sweetened drinks and fruit juice did not look like the safe swap people assume they are. The researchers concluded plainly that water is the better substitution. Itandapos, like trying to rinse a sticky glass with syrup. Euandapos, reusing liquid. Yes, you are not getting the glass clean. What to do? Donandapos, ban the drink you enjoy. That never lasts. Reorder it. Have a full glass of water first, then the tea or juice, and Euandapos will find you want less of it. Cut juice with water by half. And if plain water is boring, and for a lot of people it genuinely is, put something in it that is Nandapos, sugar, slices of lemon or orange, cucumber, a few mint leaves, cold brewed unsweetened tea. It all counts. Mistake number 4, deliberately drinking less to avoid the bathroom. I want to handle this one with real respect because it is not laziness and it is not ignorance. People do this for good reasons. Getting up 3 times a night is exhausting. Walking to a dark bathroom at 2 in the morning is genuinely how a lot of falls and broken hips happen. Some people have urgency problems they andropause, rather not discuss. Some people are avoiding a long car journey or a long service at their place of worship, so they quietly ration their fluids. What andropause happening inside is that you andropause have turned off the water main because one tap drips. The nighttime problem does get smaller, but you andropause have now put your whole system into water conservation mode. Vasoprene up, blood more concentrated. Liver getting the wrong instruction for 24 hours a day to solve a problem that only exists for 8. What to do, and this is the key insight, is change the timing, not the total. Move your fluids forward in the day. Drink most of your water between waking and late afternoon. Then taper in the 2 to 3 hours before bed. You get the same total intake and far fewer night trips. And then do the 2 safety things. Make the path to your bathroom safe. A nightlight, nothing on the floor, a clear route. And second, this one matters. Mention the frequent nighttime urination to your doctor, rather than just working around it. Getting up repeatedly at night can be a symptom in its own right. Speak. It can be a sign of high blood sugar, of prostate changes, of heart or kidney issues, of a medication effect. Some of those are very treatable. Rationing your water hides the signal instead of solving it. Mistake number 5, not knowing that your medications changed your water math. What this looks like, you andropause have been drinking the same amount for 30 years and it always suited you fine. Then over the last few years, you andropause have picked up a couple of prescriptions. Nobody sat you down and said, and quite by the way, your fluid needs are different now. What andropause happening inside depends on the medication. Water, pills, diuretics do exactly what the name says, and they andropause are extremely common for blood pressure and heart conditions. And they're andropause, a newer class of diabetes medications, the SGLT2 inhibitors. You may know them by names like empagliflozin or dapagliflozin that work in a fascinating way. They make the kidneys dump excess sugar into the urine on purpose. The andropause rate genuinely valuable drugs with real heart and kidney benefits. But remember that glucose drags water with it. The manufacturer and APOs own FDA labeling flags that older patients with reduced kidney function, and patients also taking loop diuretics may be at increased risk of volume depletion. Add in a stomach bug, a fever, or a heat wave, and the math shifts again in a single day. What to do? This is a conversation, not a decision you make alone. Take your full medication list, including anything over the counter, to your doctor or your pharmacist. Ask one specific question. Does anything on this list increase my fluid losses? And what andropause a sensible daily fluid target for me? Write the answer down. And never ever start, stop, skip, or adjust a prescription on your own based on a video. Not this one, not any other. Mistake number 6, and this is the one that catches people who are genuinely trying. Assuming more is always better. You andropause have heard the message, you andropause have taken it seriously, and now you andropause are carrying a large bottle everywhere and forcing down 4 litres a day because if some is good, more must be better. Here andropause, why that logic breaks. For some people, fluid is medically restricted. If you have heart failure, your doctor may have given you a specific fluid limit because excess fluid backs up where it shouldn't andropause. Same with advanced kidney disease, where the kidneys can no longer clear a large load. And in anyone, drinking a very large volume of plain water faster than the kidneys can handle it can dilute the sodium in your blood, a condition called hyponatria, which in older adults can cause confusion, weakness, and falls. Think of it this way. A bucket with a hole in it needs constant topping up. A bucket with a lid on it does not. Which bucket you are depends on your kidneys and your heart, and you don't andropause, get to guess. For reference points, not prescriptions, the European Food Safety Authority sets an adequate total water intake of about 2 litres a day for women and 2.5 litres for men, and applies the same figures to older adults. The US National ME set higher numbers, around 2.7 litres for women and 3.7 litres for men. Both of those figures include water from food, which typically supplies about 1/5 of your total. And both bodies stress the same caveat. These are population averages observed in healthy people, not a target every individual must hit. What to do? Get a number from your own doctor, especially if you have heart or kidney disease. For most healthy older adults, steady sipping through the day beats large volumes at once. And if you ever feel confused, unsteady, or unusually weak after significantly increasing your water intake, the andropause, a call to your doctor, not something to push through. Now, andropause, do something practical. 3 checks right where you andropause ray sitting. None of these diagnose anything. The andropause ray conversation starters for your next appointment. Check 1. The next time you use the bathroom, look at the colour. Speak. Speak pale straw, like very weak tea or light lemonade, generally suggests your adipose are in reasonable shape. Dark amber, like apple juice, suggests your kidneys are conserving water, which means vasopressin is working overtime. Two important caveats. B vitamins turn urine bright yellow, and some foods and medications change the color entirely. So, this test is non-adipose, reliable if any of those apply. And this one is not negotiable. If you ever see blood or urine that looks pink, red, or the color of cola, that is not a hydration question. The Tandiposa call your doctor today question, check 2. Try to reconstruct yesterday, not today. Yesterday because today is still in progress and you undapos will flatter yourself. Walk through it hour by hour and count actual glasses of fluid. Most people who are certain they drink enough discover they can only account for 2 or 3. That gap between what you assume and what you can actually recall is the useful information here. Check 3. And eandiposum, including this one specifically to correct something. You may have heard of the skin pinch test. Pinch the skin on the back of your hand, let go, see how fast it springs back. Here andipose a problem. Skin loses elasticity as a normal part of aging, so in an older adult, slow returning skin may tell you about your birthdays rather than your fluid status. Etandipos is a poor test after 60. A better everyday observation is your mouth on waking. Is your tongue dry and sticky first thing in the morning? Most mornings. Are your lips cracked? Persistent morning dry mouth is worth mentioning to your doctor, partly for hydration, partly because dry mouth is also a side effect of many common medications, and partly because increased thirst can itself be a sign of blood sugar running high. And while we're andipos A here, let me draw a hard line because some things are not for home management. If you or someone you andapos re caring for shows sudden confusion, unusual drowsiness or difficulty waking, very high glucose readings on a meter, extreme thirst combined with very large volumes of urine, or has stopped passing urine for many hours, that is an emergency. Call emergency services or go to the emergency department. Do not offer a big glass of water and wait to see. Everything eandiposed described in this video is support alongside your medical care. None of it is a substitute for it. Now, let me show you how this fits together. Picture someone. Latandipos, call him Fed. 73, retired, lives with his wife, generally sensible about his health. Over the past year, Hyandipos has been getting up 2 or 3 times a night, which wrecks his sleep and worries his wife because the hallway is dark. So he does the logical thing. He stops drinking after 5 in the afternoon. Then he trims lunchtime drinks too, just to be safe. His mornings start with strong coffee and nothing else until noon. His night trips do get a little better, but Hyandipos is tired all the time now. He blames his age. His mouth is dry in the morning, so he starts keeping boiled sweets by the bed. His afternoon energy dips, so he has sweet tea around 4 to get through it. Hyandipos, not doing anything reckless. Every single step made sense at the time. At his annual check, his fasting glucose has drifted up from the previous year. Not dramatically, enough that his doctor wants to talk. Now, imagine the conversation goes well. The doctor has 10 unhurried minutes. And instead of only adjusting a number, she asks what a normal day of drinking looks like. It comes out in 2 minutes flat. The 5 cut off, the empty mornings, the boiled sweets, the 4 sweet tea. She does an andapos, hand him a miracle. She changes the shape of his day. Water by the bed first thing before coffee. Fluids front-loaded through the morning and early afternoon. Taper after 6 instead of stopping at 5. Nightlight in the hall, and the rug moved out of the way. Sweet tea swapped for cold tea with lemon. And crucially, she does nandapos, dismiss the night urination, speak. She investigates it as its own symptom because it might be his blood sugar or his prostate or one of his medications. That's a hypothetical person, and I've made him up to show you the pattern. But that pattern, a sensible seeming decision that quietly costs you across every other hour, is extremely real, and it is very fixable. So here's your practical protocol. 7 steps, all free. Start today. Put the glass by the bed before you forget. That's the whole first step. Everything here is for education, not diagnosis. Please take it to your own doctor for your specific situation, especially if you have heart or kidney disease or you're on a fluid restriction. If this was useful, subscribe and hit like so more people find it. I'll see you in the next one. This video is for educational purposes only and is not intended as medical advice, diagnosis or treatment. Always consult your physician or qualified healthcare provider before making any changes to your diet, hydration, medications or health routine, especially if you have diabetes, kidney disease, heart disease or other medical conditions.